This podcast contains our own personal views not associated with any organisation. Coronial contains descriptions of death inquests that may be graphic and disturbing to some listeners. Discretion is advised. All right, welcome back to Coronial, everyone. I'm Georgie.
I'm Emma.
And I'm Alice.
And today I'm going to be discussing the death of George Diamond, who was 18 years of age when he died on the 21st of February, 2019. So a little bit about George. He was the oldest of 5 children in a very close family, so all lived together and involved in each other's lives, as families sometimes can be. And he also worked as an apprentice carpenter. And of note, he had no chronic medical conditions. In the 7 months prior to George's death, he had joined a gym and became interested in the sport of boxing. And during this 7 months, he attended the gym to participate in boxing training, including regular sparring sessions, which are typically just practice sessions that involve lighter blows than would normally occur in a competition fight.
Yeah, that makes sense.
Yeah.
You don't want to be going full force all the time.
Yeah, exactly. But you still have to practice, and you know the point of boxing is to hit each other. You still have to practice that motion and that technique and strategy. I guess it's a sport. Maybe there's some.
Yeah. There definitely is with boxing. It's a sport I don't understand.
Me neither.
Absolutely. That's right. I've got some good comments around that. These boxing sessions at the gym were conducted by one of the gym owners, who at the time of the inquest had been a licensed and registered boxing trainer with the Victorian Amateur Boxing League, or I'm going to refer to them as VABL, and had experience for more than 12 years as a trainer. Of note, VABL is a recognised amateur boxing self-regulated association because there's no formal relationship between them and what is the professional boxing regulation, which is pursuant to the Professional Boxing and Combat Sports Act of 1985.
So why aren't they associated with?
Because they're not a professional association, so they don't fall under that.
They're just like
They're an amateur association.
But they don't. Okay, so amateur associations don't fall under the
Professional
act either.
No. And the coroner did not seem impressed by that.
It doesn't really make sense to me because it's all the same sport.
It's a good question. It doesn't make sense to me either.
You would think even like amateur hockey, I would assume would still be regulated under a national hockey association or legislation or codes.
Fair. I
don't know.
Yeah, I don't have a good answer for you on that one of like, I don't know why it's not.
Yeah.
Because you think it should be, right?
Yeah.
It should just
make things a lot more streamlined, wouldn't it?
Yeah. And I don't know if the Victorian Amateur Boxing League follow the code anyway.
Yeah,
they
follow different rules, potentially.
Yeah, they might have to adapt them based on, amateur versus professional, but also because they might have to account for children or people under the age of 18.
And weights and...
Yeah, so different rules. And there's certain like punching to their, I don't know.
Various areas and whatever
rules.
might be prevented.
Exactly.
Yeah. So in addition to offering training, the gym staff also organised members to fight in amateur contests should they wish. And talking of, it being a super unsafe sport, I did pull out one quote from the inquest, which was provided by a neurosurgeon that stated that boxing is the only contact sport whose primary aim is to render the opponent unconscious by striking blows to their head.
Yeah, it makes no sense.
Yeah. Since the introduction of the Marquis of Queensberry rules, which must be some sort of specific rules to boxing that I've never heard of, governing modern boxing in 1867, there have been more than 1,800 deaths recorded following a boxing match.
Wow.
Most deaths following a boxing injury involve a subdural hemorrhage or a contusion swelling of the brain.
Which makes sense because you're being hit in the head repeatedly.
Yeah.
And you're even then potentially like you're getting hit in the head, knocked out, you're falling onto the
floor, so then you also may injure yourself again. Yep. Yeah. And that 1,800 deaths, it didn't say where they were referencing. So I have no idea if that's global or if that's Australia or if that's a particular location within the world.
Yeah.
So it could be more than that if it's just one particular location. I forget that it is the only sport that the aim is to smack someone else in the face.
Yep.
Yeah, like other sports, that's a consequence. And like even in other fighting sports like MMA, that happens, but it's not
the primary aim.
Yeah, like you've got other ways of fighting.
But then we have so many other sports where our primary aim is to make sure that does not happen, such as rugby and AFL football and I mean even soccer, hockey, many other sports where it's like there is a specific rule against any contact to the head.
Yeah.
Which is mind-blowing. Anyway, so getting to George's death. On the 18th of February 2019, following work, George participated in a 5-kilometre run organised by the gym. He then attended a sparring session, which began with a skipping warm-up for 15 minutes, followed by sparring for 15 minutes.
That sounds like a lot of exercise to do in February. Like hot.
It also looked like it was an outdoor run. And then he had to go home quickly and then come back. And that also, again, wasn't described whether he drove or whether he just like casually jogged home. Like I was just like,
wow.
And when you say a skipping workout,
like skipping for 15 minutes, that's tiring.
I'm assuming you're meaning skipping with a skipping rope, but my brain goes to skipping.
No.
The classic
jump rope.
Yeah, the classic 5-year-old skip.
I mean, I don't think the inquest specified.
No, I assume it was skipping with a skipping rope, but that's just where my mind went. Just a bunch of guys just
skipping up and back. So after the 15 minutes of sparring, he left the ring and moved to the weights area of the gym prior to then proceeding to the exit. As part of the inquest, it was reviewed on CCTV that George was noted to be moving in an unsteady manner at this point, and his legs were seen to be shaking. At the exit of the gym, George collapsed. He was assisted by a number of other gym members and an ambulance was called. Upon the arrival of the paramedics, George was found to be unresponsive, and this was within 6 to 8 minutes of him collapsing in the first place.
Wow.
So essentially he just walked out and collapsed and became unresponsive.
Yeah, and I'm guessing that was that sort of thing where he was feeling unwell, so he's like, I need to get some air.
Yeah.
So he went outside and then,
Yeah. Assuming he was just like, I don't feel right.
Yeah.
And probably also just didn't really have a lot of self-control at that point either, like thought processing in general. Yeah. George was transported to the Alfred Hospital where a CT was performed which demonstrated an acute right convexity subdural hematoma with resultant mass effect, which essentially just means that there was so much blood accumulated within the skull that it was putting pressure on his brain because it's an enclosed space, and so if you have liquid pressure on the mass, then it moves the mass.
And brains don't like being moved.
Not particularly. And if there's enough pressure in, because there's nowhere to go, it just goes out the bottom where there's an open hole of the bottom of the skull.
Yeah, that's not ideal.
Very much not ideal. A subdural hematoma is where there's bleeding under the fibrous outermost membrane surrounding the brain, which is called the dura, so below dural. George underwent emergency surgery, which included a craniectomy, a subdural hematoma evacuation, and the insertion of an intracranial pressure monitor. However, unfortunately, 2 days later, a nuclear medicine scan demonstrated absent cerebral perfusion, which indicated brain death.
Right.
George passed away the following day after this, after his family decided to cease life support in the context of brain death. An autopsy into George's death reported his death was caused by a subdural hemorrhage, which we know.
Yep.
However, there was evidence of an older subdural hemorrhage. It was noted by the forensic pathologist that a subdural hemorrhage can occur more easily in those who've previously had a subdural hemorrhage due to the phenomenon of rebleeding. It was further reported that this was what likely occurred in George's case, and that this rebleeding can occur either spontaneously or in the setting of relatively minor trauma, such as sparring at the gym.
Yeah, like a very slight head nod.
But it could have been his skipping.
Yeah,
for all we
just
know.
the movement of his skull, brain.
Yeah, again, it can happen spontaneously, so it could have just been doing nothing and it could have just re-bled.
Yeah. Is this kind of like
terrifying?
When you break a bone and it's not healed properly, it's more
susceptible.
Again.
Yeah, I think
you've already got an existing damage to that area, and so it can.
Yeah, they essentially said that because it's like scarring and healing tissue, it's weakening the blood vessels in that area, or they're not as robust, and so therefore more susceptible to rebleeding and injury. Yeah. The scar tissue that they talked about that he'd had a previous bleed can't be aged with certainty though, so they couldn't tell exactly when he potentially had incurred the previous subdural hematoma based on that autopsy.
Yeah, it could have been years and years ago, or it could have been a few weeks. I suppose if it's still healing, it wouldn't have been that long ago.
Doesn't say whether it was technically healing or anything like that. And it says it's not possible to determine when the old subdural hematoma occurred, but I'm not sure about the age in terms of
Like the time frame.
the scar tissue is laid down over the weeks to months following the subdural hemorrhage. So presumably within that time frame, it doesn't specify like what's your absolute end limit
Yeah, cool.
of whether it could be years in the past.
Yep.
It was identified that George sustained a symptomatic head injury 4 months prior to his death, again during a boxing sparring session. Hence, the coronial inquest primarily reviewed the history and medical treatment of the previously sustained symptomatic head injury and George's return to boxing. Essentially trying to identify, did he have a subdural hemorrhage at that point that went unidentified. So 4 months prior to George's death on the 25th of October 2018, during a sparring session, George received a number of blows to his head. And because I enjoyed this quote, I needed to write it down and introduce it here. The boxing trainer documented in the gym's diary, and I quote, "George hit in testicles during sparring. Felt a bit dizzy afterwards, so I assessed him for a concussion. He seemed fine after a drink and a rest."
Yeah, because most people's
Brain
brains are
hurts.
attached to their testicles.
I know, I was like, this doesn't talk about him getting hit in the head at all. But yeah, you assessed him for a concussion. Do you assess anyone who gets hit in the testicles for a concussion?
Like, unless he got hit in the testicles and the pain was so bad that he fell over and hit his head.
So what actually
But-
seems to have occurred based on the rest of the inquest was he got hit in the testicles that caused him to crunch over and then got hit in the head
Oh, okay.
as a result of the fact that,
He was hunched over.
the initial blow caused the opening for the sparring partner to then,
Hit him in the head.
yes.
Oh, talk about a low blow.
Yeah. And so that's, in fact, the events that occurred rather than
Just the
he
testicles.
got a head injury from getting hit in the
that makes no
testicles.
sense.
It was reported that the blows to either his groin or head caused him to fall to the ground and that he experienced at least dizziness and discomfort at this point. So it was a moderate injury that occurred.
Yeah.
The inquest findings also noted that while the trainer had basic first aid training, this did not include any specific concussion training.
Why?
So-
You're a boxing trainer.
In terms of assessed him for concussion, what does that even mean?
Yeah.
And that could not be defined at
They
the
just
inquest.
checked to make sure he's still awake and breathing, and that's
Yeah.
the extent.
They do some
you
of the
remember
like
what your name is?
follow my finger.
Yeah.
But
Which is
if
not,
you aren't trained to do that,
Yeah,
what does that
exactly.
actually
It has
achieve?
no meaning.
Do you know what you're
Nothing at
doing
all.
if you're asking someone to follow your
No.
finger?
No.
Exactly. Following the incident, George was able to drive himself home, which is questionable, but that's okay.
Yep.
Reported to his father that he was a little nauseous, had a headache, and some back pain. He took some pain relief for his symptoms before going to bed. And then his parents monitored him a lot. It seems
Okay,
like they
good.
were stressed,
Okay,
but he was
cool.
just like, all right, I'm going to bed.
And they're like, we're going to check on you every 2 hours.
Pretty much, yeah. So the following day, George attempted to go to work, but he was unable to do his usual daily tasks and reported to have ongoing nausea and vomiting to the point where his boss sent him home.
Fair.
Due to these symptoms, he then presented to his local GP practice for review, where he was seen, assessed, and given advice about concerning signs and symptoms to look out for in terms of a head injury. And basically like, yeah, you feel this way because you got hit in the head. But here's some reasons that you should come back or present to an emergency department, which all sounded very appropriate.
Yep.
And so there were no concerns with this medical care, and ultimately the inquest didn't go into that in any detail. So another 6 days later, on the 31st of October, George returned to the same GP practice, but this time seeing a different GP. And this was to report that he had ongoing symptoms of his head injury as well as lower back pain. And so this was, in fact, doing exactly as he had been advised of, if you've got ongoing symptoms, please come back to see us.
Yep.
The GP notes stated that he had stable observations and no neurological symptoms or examination findings of concern. He was encouraged to return again in 5 days for further review of his symptoms.
So at this point, he'd been having symptoms for a week?
6 days.
Yeah.
And so it was like, cool, come back and see us again in 5 days if this is still a problem.
Yeah.
Was essentially the outcome.
I just feel like if I'm still having symptoms from my head injury 6 days ago, I'm pretty concerned.
Yeah, look,
And like clearly he was because he went back to the doctor.
yeah.
I just wonder whether should something have been done at that point.
But, well,
I mean, what
how-
can you do?
Yeah, and the other thing is, like, how bad are your symptoms? Because, like,
Yeah.
it's not uncommon for a concussion to last that long and
Yeah.
for
Right.
symptoms to be ongoing, but you would assume that they're going to progressively get better.
Yeah.
So, or versus are they getting worse? And it's really hard with the GP note stating that his obs were stable. It's like, well, if you've got a head injury, I don't really expect your breathing and heart rate to be particularly off unless you're like unconscious.
Yeah.
And then it said no neurological symptoms. I'm like, but he was literally returning because he had ongoing symptoms of his concussion. So what do you mean he had no neurological symptoms? Like,
yeah.
What? And then no examination findings of concern. I'm like, okay, you mean that there was no dangerous things that needed follow-up? Fine. But also that was essentially the extent of the notes. So the inquest findings identified that the GP's note-taking at this review fell well below the standard that could be reasonably expected for a GP.
Yeah.
And so hence it's possible to assess from those notes as to what George's symptoms were. Did he in fact have ongoing symptoms? And was there any worsening since his original injury?
Yeah.
So in terms of like what could you possibly do, then it would very much depend on what he was presenting back there for.
Yeah.
But clearly he came back, so clearly he's not entirely better.
Yeah.
But how bad was he? Unclear. There was a lot of debate from expert witnesses as to if he had in fact reported worsening headache, whether a CT could and should have been done for his head to scan for identifiable brain injuries such as bleeding.
Yeah.
Because at that point, would there be any treatment that he could go on, or would it just be you need to be careful
Yeah,
with
depending
your
on
brain for a while?
Depending on how bad it is, it sounded like, there wouldn't be an obvious treatment such as like, when he died, that there was a craniectomy and an evacuation and all that kind of stuff. He's still up, he's still breathing, he's still functioning.
Yep.
So I don't think that they're going to be doing any brain surgery. But yes, they're definitely not going to suggest you go back to boxing.
Yes, until
At
your
any
brain is
point.
fully healed.
Yeah. So,
Potentially ever.
Just don't box.
yeah, I know.
Don't do it.
And so with all that debate, there ended up being 2 GP expert witnesses and 2 ED doctor expert witnesses. And the coroner ultimately preferred the expert witnesses' evidence that said that there was no absolute indication to have done a head scan at that point, but that it wouldn't have been unreasonable to do one or to request one. And that that could have been semi-urgent. It didn't need to be like right here, right now.
Yep. They could have written a referral and
They could have had it in a couple of days. Yeah. But there was a lot of contention with the expert witnesses because I think that they were all using the sense that his headaches were worsened, but technically the notes never said that, as you can't necessarily make that assumption. Yeah. And so I think that's that really hard part of expert witnesses is like you kind of read into it more than you mean to, and that can bias the answers that you give. Because I had this long bit of being like, hang on, how did 3 out of the 4 said you should have done a CT and then 1 said you didn't have to, and that's the one the coroner went with. Yeah. But then there was a whole bunch of explanations as to how the coroner came to that based on some other points that one of the counsel assisting had put in. Mm-hmm. Anyway, so that I found interesting. Anyway, the coroner did state that it would have been prudent to recommend that if his symptoms continued or worsened, that he should return for further assessment, and that at that point a CT or an MRI could have been done. So basically saying the GP should have said, if you do end up having ongoing symptoms, we should scan your head. Mm-hmm. So that the patient is then aware of that and empowered to do so and return and that kind of thing. But that couldn't clearly be defined to have occurred because it wasn't documented.
Yep.
So that further 5 days later, yes, he still had ongoing symptoms, but instead of returning to the GP, he ended up going to the local emergency department at Frankston Hospital. This is where he reported he had ongoing headache, a recent vomit, and worsening back pain. And so I think that back pain also could have hindered some of this of which was the bit that was worse for him. It doesn't really... You can't tell necessarily from the notes.
Yeah, was he in a heap of pain from the back pain and he happened to have a
headache or
was the headache the bad thing and he just happened to have back pain?
Yeah. He did attend the department with his father, and during this review, George's father requested a medical scan of George's head be considered. However, the doctor reviewing George did not feel that the benefits of the CT outweighed its risks. And in the inquest, the ED doctor clarified that these risks they were concerned about was those specifically relating to radiation and its association with the development of cancer. Just for fun facts and because of my personal bugbear, it's estimated the scan of the head is the equivalent to the exposure that an individual would be exposed to generally in their life over a period of 8 months.
Okay.
So is the equivalent. It's between 1 and 4 millisievert exposure, which is just the unit of measurement of exposure of radiation.
Mm-hmm.
And that's related to US data. I couldn't really find anything from Australia, but I would presume Australia's got similar exposure rates. And 2 cross-country flights.
I was about to ask that. What's that in like flights?
In Australia. Oh, no, that's in the US. 2 cross-country, so going across the distance of US is what you get from a single chest x-ray. So, like, all of this is just saying that our technologies have changed a lot over time and that they are as low radiation as possible now, and so that they are not hugely dissimilar to the amount of radiation that you're going to get in general life anyway.
Yeah.
And presumably not so much of an issue when you have a one-off scan versus those that have a reasoning that they're getting multiple scans across their life and multiple exposures.
Mm-hmm.
Yeah, and being an 18-year-old
who has no other medical health problems,
like it's not
has
like
probably
he's
barely had scans in his life anyway.
I really don't see that as being a reason you wouldn't do
That in that,
like, yes, there is a risk of radiation, but it is so small.
Yeah.
In a one-off scan, like you said.
Yeah, and so essentially in the
the
inquest,
risks of the head injury far outweigh the risks of the radiation.
but I think the ED doctor was also coming at it from what's the benefit? Well, we're not going to cut into this individual's head here now in the ED.
Yeah.
So we don't need to do it here in the ED.
True.
And that's also the argument that, like, the benefits are very different in an emergency department versus a GP practice.
Yeah, gotcha.
But at the same time, like...
Couldn't the ED doctor have written a referral for him to have gotten a CT somewhere else?
Absolutely. Or empower George to go see his GP for the GP to write the referral as well.
And, like, send the notes from his ED visit to his GP that recommends he have
as a CT scan as well. So in terms of the CT, expert review did have conflicting reviews about the necessity to perform a CT head during this review. And the coroner ultimately found, yes, it should have been ordered, but again, in that context, it could have been referred on to the GP so that it could have done in that non-urgent setting. Yep. Again, should the ED doctor have been very specifically against doing it in the emergency department. The coroner also found that George should have been advised not to return to boxing or any potentially traumatic activity until the results of any scan were known.
Yep.
So that a scan was necessary as a reason to get back to boxing if that's what you wanted to do.
Yep.
And then just of note, the ED doctor did diagnose George with what was probably a generic term in their computer system of an intracranial injury, which included concussion.
Yep. And
did give George the advice to return to ED if he had ongoing symptoms again and not to return to boxing until he was medically cleared by his GP. So that just slight definition of the coroner being like, no, it should have been until there was a scan that said that you could return, that you would be safe to. And this was because George was at risk of severe or worsening injury or delayed recovery should he suffer another head injury in such a short space of time.
Yep.
It was reported by an expert witness neurosurgeon. So remember, they deal with brains all day, every day. So they might have, again, a bit more bias around what should have been done, that they felt a CT scan should have been undertaken during his ED presentation, as it more likely than not would have revealed that George, in fact, had a subdural hematoma based on the evidence.
Yep.
Hence, the coroner found that this was a missed opportunity to prevent George's death, as the coroner reported that had he had this information, he wouldn't have returned to boxing.
Oh, I don't think you can say he definitely wouldn't have, but it would have been much less likely for him to.
He wouldn't have returned to boxing until it was clear that he was no longer at risk from the injury that he had at that point in time, if that makes sense.
Yeah.
I guess.
And it seemed like he was the sort of person who would listen to.
Yeah, that he and his family were conscientious enough to say, okay, there is definitely this subdural hematoma. We know the evidence is that you could have another one if you have sustained injuries. So he's not going to do that until that injury is completely resolved.
Yeah.
How he ended up going back to boxing was also quite a contentious issue because at this point when he'd seen the GP, it was still like, don't go back until your head injury is better.
Yep.
So within the first week following his head injury, George notified the boxing trainer that he had ongoing symptoms of concussion. And this resulted in his gym membership being suspended around the 5th of November, so about a week after the actual head injury.
Yep.
And is this just like it's suspended so he doesn't have to pay for it while he's not going to be attending?
Essentially.
I would assume so. Yeah.
But it's proof that they knew
Yes.
that he had a head injury.
Yep.
It was identified during the inquest that George did participate in a sparring contest at a different boxing club on the 11th of December, but the boxing trainer attended this event and was aware of George's participation.
I was like, it's a different place. They didn't know.
Yeah, no.
His trainer did.
The boxing trainer did try to suggest that they were unaware that George was there, but there was photographic evidence and text messages between them. So,
Why
Are you
would
going to be
try
there?
and
sorry, there's
lie
photographic
about
evidence
that?
of the fact that George was there because he tried to say,
okay.
George wasn't there. And, then there was text messages between them that he would have known that George was there.
Yeah.
Look, why are you
So
trying to lie
George.
about this? I don't know. No evidence was found to suggest that George sustained any injury at this event. By late December or early January, George had returned to regular training and his gym membership was found to have been reinstated on the 11th of January 2019. But again, so that like whole pause, it does seem like he was still going back in December though. So
Yeah.
It wasn't until the 25th of January that George attended his GP for another review. And at this time, he saw a completion of a VABL certificate of fitness from his GP. This form certified individuals as fit to compete in amateur boxing contests and included that individuals had been screened for things like bloodborne diseases, given the potential infection risk when competing. So the same GP that saw him at the 6 days following his head injury, the one with the poor note-taking, reviewed George at this stage. Again, at the inquest, the notes from his appointment were reported to be poor, and it was unable to be ascertained as to whether the GP reviewed George's recent appointment notes, and there was also no evidence to suggest that there was any summary from the emergency department presentation available or reviewed during that appointment.
Gotcha.
There was no documentation of any persisting symptoms of previous injury, and this was confirmed by George's father, who stated that he was not complaining of any symptoms around this time, which was about 3 months since the injury.
Okay.
The GP ultimately completed the certificate of fitness form, and at the inquest, the GP stated that he'd rarely encountered a certificate of fitness forms, but understood that he was certifying that George was fit to return to boxing. The GP reported that their usual practice was ask the patient if they had any symptoms that might suggest that they were not fit to compete in the sport or not return
Patients
to the
never
sport.
lie.
Yeah.
When they
Yeah,
want to
I
go
was
back
like,
to a sport that they love doing.
yeah. And I was like, but what? It's not George's responsibility to identify what should prevent him from going back as well.
Yeah, you should be asking him targeted questions.
Yeah. But also, like, if you noted that he'd had a head injury 3 months ago because you'd looked at his notes of the last time you saw him,
Yep.
you might have been like, actually, should we check in on that?
Yep.
Do you know how to protect yourself given you've had a recent head injury? But again, 3 months, and if you're no longer symptomatic, does that preclude you from actually going back? Probably not. It could not be confirmed due to lack of note-taking and documentation as to what specifically occurred in terms of the questioning and the filling out of this form, other than it was completed. Expert review was fairly consistent that it may not have been appropriate to sign the form, given the doctor was unfamiliar with it. So not necessarily that you shouldn't have certified George. It's just like, if you don't know what this paper's certifying, don't do it.
Yeah.
That makes sense.
Suggestions provided from these experts included that the GP could have deferred signing the form until further research had been completed to understand the ramifications of signing it. Or alternatively, the GP could have referred George to a more specialised GP who was competent in completing examinations for certification of fitness to compete in amateur sports. It was mentioned that this is not uncommon for patients presenting in the context of things such as scuba diving or pilots. So like that it's not uncommon for GPs to be like, there are people who are specialised in this, you should see them.
Yeah.
They
and,
know
like,
what to do. Because I was initially being like, what do you mean refer someone to specialise? And then they mentioned scuba diving and pilots. And I was like, right, because there are really specific like occupational needs and stuff like that. And so people, or I presumably if you're a football player or in a professional sport, they'd be recommended practitioners to see.
Yep.
In contrast, another expert witness suggested that in the absence of symptoms for a 3-month period, then it may not require further inquiry, and hence that a recent head injury didn't preclude the signing of the form, which I think isn't unreasonable. Like,
Yeah, it depends on
because we assumed that this was a simple concussion based on essentially what had been found along the way. The coroner found that the GP should not have signed the form without undertaking a comprehensive review of George's medical history. So actually having looked at the previous notes and previous presentations, undertaking steps to understand what should be involved when providing a medical clearance to return to boxing, Or alternatively, the GP could have referred George, as mentioned. Additionally, the coroner also suggested that improvements to the form could be considered to provide clarity for medical practitioners. So it was suggested that organisations such as the Royal Australian College of General Practitioners could consider preparation of appropriate education information for GPs to assist with the completion of return to boxing medical certification. I was like, that seems overly specific. Maybe return to high-risk
Combat
sports.
sport.
Yeah.
Combat sports might be a bit better, but sure. But, you know, essentially making sure that GPs are aware of what they need to consider when saying that someone's fit to compete in a combat sport because of the specific high risks involved. Following George's final GP appointment, the evidence supports the conclusion that George increased the intensity of his training and by the 2nd of February also participated in an exhibition contest and on the 12th of February completed another sparring session. But again, there were no reports of injury or issues occurring at either of these sessions. And so it wasn't until his final sparring session that he obviously ultimately then had that re-bleed. But basically, from all the evidence suggested that this injury that occurred 4 months prior to his death was in fact a subdural hemorrhage that went unidentified, and hence that he was unaware of his specific high risk that should have had associated with it medical advice to not return to boxing because of that specific high risk. So the formal recommendations that came from the coroner included that the Victorian government extend the terms of reference of their regulatory review to include amateur contact sports rather than it being for only professional organisations. So Emma, coming back to your point of like, why do they not include that? Seems like the coroner agreed.
Yeah.
And that's also in the context of the fact that the Victorian government were completing a regulatory review based on previous inquest findings that this coroner had also provided.
Right.
And that's where that duplication
Yeah.
that I talked about was that this coroner was like, I made all these inquests about this, but in the context of professional boxing. So now I have to do it all over again in the context of amateur boxing. So instead, the coroner just said, in order to not duplicate findings, which apparently is part of the Coronial Act,
Sure.
Oh, there you go. I didn't know that.
I will just refer you to this other one and do what the other one says in the context of amateur.
Yeah.
Yep.
And so the review should adequately address participant safety and standardised training and education regimes for amateur boxers, and that there's already a review going on by the Victorian government for professional boxing. The regulatory review should be extended to include the requirements for an individual to be cleared before commencing amateur boxing or combat sports for the first time or before they return following injury. And so this information should include whether this clearance should be obtained from a medical practitioner who is certified specifically to do so, which again, to me seemed a little bit extreme that you then have to be a medical practitioner who's certified in that certification of fitness for return to sports versus just being a medical practitioner who has some knowledge in that area that therefore feels comfortable doing it.
Yeah, I don't know whether the ones who do the scuba diving stuff, whether they have any specific like training and certification in that.
Well, I think there's a difference between training and specific certification because like I'm assuming the College of General Practitioners puts out stuff around certifying for scuba diving. And I'm sure that they do it for pilots as well. Like in those industries where there's also an occupational association to it, that I would assume that there's guidance out there somewhere. But do you need to like be formally approved to do so? Or is it your responsibility to just make sure that you are capable of doing the thing that you're like the service that you're providing?
Yeah, I feel like if we're talking about pilots, like commercial pilots, if I'm flying on a plane, I would like my pilot to have been checked
By someone who's
by
certified
someone
to do.
who's
Yeah, true.
been actually trained.
Yeah,
and in a
fair.
formalized way.
Fair. And so it's hard then when you have that crossover to like a professional sport
Yes, because
because it's for entertainment, it's not for occupation.
And the risk to other people
Is
is
lower.
minimal to
Yeah.
negligible in comparison to a pilot.
Yeah, fair.
Oh. Sorry, I'm just looking up pilot doctors.
Pilot doctors. Is that what you typed into Google?
So they are designated aviation medical examiners.
Yeah,
and
yeah,
members
okay.
of the Australasian Society of Aerospace Medicine.
Oh, cool. Okay. That's good to know. Yeah, right. So yeah, okay. So they're in specific high risk occupations where there's risk to others.
Yep.
Then absolutely it does seem like you have to be certified. But that crossover to a sport
Yeah,
to
I
me
think the
seems
sport
harder.
Yeah, it's different.
And then consideration should be given to updating the form so that it makes it easier for medical practitioners to know what their requirements are. And I think that's not unreasonable to just put on like, please click this link to have a set of things and questions you should have considered asking this patient, other than, do you think you're fit to box?
Yes.
Because I'm not sure that that covers it.
Interestingly, the scuba diving ones also,
Needed as well.
yeah, they have completed a course in diving medicine and follow the dive standards for medicals.
Yeah, nice. That makes me feel very happy.
Yeah.
But how many areas is that going to progress to? Like, 'cause they're two examples. Surely there's others that I just can't think of off the top of my head of like, but then how far do you go?
Well, yeah, that's it.
Where
Especially
does it stop?
in an amateur sporting
Yeah, capacity as well.
environment.
Because, you know, like race drivers where you're just
And I guess if you're a professional, you would have as part of your team,
something.
you would have a
hope.
doctor who would
Yeah.
have experience in that sport.
But is that specifically certified, or again, is that just because
Yeah.
they've ended up in that position because they've got an interest, and then it's, where's that regulation lie then as well? The final two recommendations included that the appropriate medical societies should consider developing appropriate mandatory training for medical practitioners in relation to providing medical clearance for individuals to commence or return to boxing and other combat sports, and develop guidelines to be followed in respect for patients presenting with mild head injuries as a result of a potentially dangerous mechanism such as boxing, which fall outside of the scope of standard head injury imaging guidelines. So basically saying that, sure, if you didn't think that that person needed a CT based on general individuals who have an accidental head injury, in the context of boxing or other combat sports where there's a designated point of trying to inflict injury on the other individual, maybe consider relaxing those regulations a little bit and actually just being a little bit more cautious and giving them a head CT, because we think that they are at a much higher risk than the standard head injury.
Yeah, like if I just trip over and hit my head and get a concussion, but I'm not involved in any contact sports whatsoever.
That is a very different risk
Yeah.
to someone specifically hit me in the head several times 3 days ago, you know, and my head still hurts.
Yep.
And so, yeah, there was a lot of sort of contention over, well, none of the guidelines for whether to scan someone's head or not really fit appropriately to George's scenario, at which point that kind of common sense was then taken away because they're like, oh, he didn't fit the guideline, happy days. And it's like, yeah, but someone hit him in the head on purpose with force.
Are guidelines, they're not absolutes.
They aren't, but sometimes you kind of get so hung up on like, okay, well, I followed this and it's fine, without then taking that step back and going, oh, yeah, right, this person was hit in the head. We've got evidence that that was the purpose of it. And so then finally, the coroner did not refer any of the medical practitioners involved in George's medical care to the Australian Health Practitioners Regulatory Agency, but did note that they were making sure that they were provided with a copy of the inquest.
Yeah, essentially like...
I'm not going to refer them, but also please read this, just in case you're worried.
I would like you to read this and maybe rethink your practices.
Yeah. And so that is the summary of those findings, that sometimes it's not the actual day's events that led to things, that there is a little bit of, you know, past digging and looking at what happened previously. And so I was always like, not shocked that it went, or that this was an inquest, but that this even, I guess it was an unexpected death. And that's why I ended up referring to the coroner, but like that they managed to put all those pieces together.
Medical care that was
there was
involved in
concern
that too. It's not like he got hit in the head and immediately died.
Yeah. And you also don't know to what extent his family also advocated.
Oh,
yeah, very true.
Well, because the father had specifically requested the head CT, I think that that was a very defining point there, that they were like, no, but we wanted this. We were worried about him. We were worried things weren't right. But again with that, but then you look in hindsight, not so worried that they prevented him from going boxing, or there was no evidence that they were telling him to not go back and all that kind of stuff either. But they were all of the opinion that it was safe for him to do so because that's the medical care that they'd received.
Yeah, exactly. Like they obviously went to the emergency department. The dad wanted the scan.
Yeah.
And when he's told by the doctor, no, actually you don't need to do that.
Yeah.
Yeah, you then get the sort of false assumption, yeah, he's all good. We don't need to.
It's totally fine. This is normal. Yeah.
And then when he got the fitness to return to sport,
again, medical
the
practitioner
GP.
was like, yeah, it's fine for you to go back.
Yep.
But also, I guess there is evidence that he was still semi-participating in between that
true.
anyway. Because that specific fitness to return was to return to amateur fights specifically,
Yeah, gotcha.
because he could train as much as he wanted at
Yeah.
the gym. Yeah. All right. Well, thanks everyone for listening.
Thank you.
Bye.
Thanks very much. Bye.